My name is Dr. Anil Dhople, and I am a board-certified radiation oncologist at Health First Cancer Center. Today I wanted to speak to you a little bit about new technologies for the treatment of lung cancer. There will be over 221,000 new cases of lung cancer diagnosed this year alone. The cornerstone to long-term curability has always centered on surgery. But unfortunately, most lung cancers are diagnosed at a more advanced stage, and that surgery is not an option. That's because the cancer has already spread to other parts of the body. Approximately 20% of lung cancers will actually be diagnosed at an early stage, which means the cancer has not spread to lymph nodes or other organs. And if a lung cancer is found at an early stage in a medically fit patient, surgery remains the cornerstone of treatment, with a cure rate of around 90%. Many patients with early stage lung cancer are not candidates for surgery due to other medical problems that they may have, such as emphysema, COPD, or heart disease. It's these patients who have lung cancers that could technically be cured with surgery, but they're not healthy enough to tolerate a large surgical procedure. So, what are the options for these patients who are not medically fit for surgery? For decades, the standard of treatment for those patients has been daily radiation treatments for 7 weeks, delivering a small dose of radiation every day to the tumor. The limitations of radiation in the past have been related to tumor motion associated with the breathing pattern of the patient and the accuracy of treatment delivery with standard radiation machines known as the linear accelerators. Unfortunately, this form of conventional fractionated radiation is associated with a cure rate of only about 30 to 40%, which is a distant second place to the 90% cure rate seen with surgery. More recently, there have been significant improvements in radiation treatment delivery and image guidance of the treatment machines. We can now accurately visualize the motion of a tumor within the lung of a breathing patient. Image guidance refers to the ability to actually visualize the tumor within the body in real time on the day of each treatment. These improvements have allowed physicians to give very high doses of radiation to the tumor while sparing normal surrounding tissue. By giving a very high dose of radiation and shaping that radiation beam very conformally to the tumor, and by being very certain of the motion of the tumor with the respiratory pattern of the patient, the entire course of radiation can be completed in less than 1 week. What previously took 7 weeks to deliver is now completed in as little as 3 to 5 days. Delivering such a high dose of radiation in such a short period of time has therapeutic advantages compared to conventionally fractionated radiation. This form of radiation is known as Stereotactic Body Radiation Therapy, or SBRT for short. SBRT is non-invasive and therefore has very few side effects. Since there's no needles puncturing the lung tissue, there is no risk of collapsing the lung. SBRT is a technology usually reserved for patients with poor lung function, and most patients do not suffer a worsening of their chronic breathing problems. Long-term studies evaluating the effectiveness of non-invasive SBRT have shown cure rates of 90%, similar to surgery. The results with SBRT in patients who are medically unfit for surgery has given rise to the thought that SBRT may actually be the treatment of choice for all early stage lung cancers, even in a patient healthy enough for surgery. So, what is the process of SBRT? First, the patient must undergo a very specialized treatment planning session. During this session, a mold of the patient's body is made to hold the patient in the proper position each day of treatment. The patient's position must be reproducible for each days of treatment. While the patient is laying on the table, infrared cameras are monitoring the breathing pattern of the patient. These sophisticated devices are used to measure and account for the respiration of the patient. The patient undergoes a respiratory-gated CT scan on this planning day, which obtains images of the tumor in conjunction with the respiratory pattern of the patient. This is a key component to an accurate SBRT treatment. Next, the physician, the dosimetrist, and the physicist work together in designing a custom SBRT treatment plan. The images obtained from the treatment planning CT scan are fused with other diagnostic imaging studies to obtain very accurate contours of the tumor. The beams of radiation used are selected in such a manner to minimize exposure of nearby critical structures, such as the heart, spinal cord, and uninvolved lung tissue. This process of treatment planning can take between 2 and 4 days. The radiation beam is shaped by a device with metallic leaves within the head of the machine called a multi-leaf collimator. These leaves can be programmed and moved independently so as to create any shape. And since the shape of a tumor is not uniform and can change with the respiration of the patient, the position of those leaves can be programmed to mirror the shape and position of the tumor. No two patients are alike, so no two SBRT plans are identical. The next step is a vigorous and thorough quality assurance process completed by the physicist and the physician. The patient is then brought in for the first day of treatment. The patient is placed comfortably on the treatment table, and a low-dose CT scan is then obtained by the actual machine that will deliver the therapeutic radiation. This is the image guidance that I referred to earlier. Based on the CT images and comparing it to the original planning CT images, coordinate system is used in a stereotactic manner to move the patient in the proper position with millimeter accuracy. Once the patient is confirmed to be in the proper treatment position, the treatment commences and can last anywhere between 3 and 5 minutes. When the treatment is completed, the patient goes home and the process repeats itself the next day. Within 1 week, the entire treatment is completed with nearly 0 side effects. Fatigue is the only common side effect, and it typically resolves within a couple hours of treatment. Patients are then periodically followed by myself and other doctors such as the pulmonologist, and long-term side effects are exceedingly rare. Success of the treatment is observed by obliteration of the tumors on serial CT scans or PET scans. Advancements in technology with SBRT have now given patients with early-stage lung cancer a chance for cure without surgery. SBRT is just one of the many technologies offered by the Health First Cancer Services.